Hello, everybody. Welcome to BFR Tuesday. What's going on over here? My name is Cara, and I'm your weekly host. So today we are going to talk about something that's been happening a lot in my clinic, which is people coming in with post-surgical atrophy, and it could be a year, 2 years after surgery, and they want to do something about it. So that's what we're going to talk about today, how we use BFR to increase size in an individual, whether they've had surgery or just disuse or brace or something like that. So I'm going to share my screen. I got a couple pictures. Right here. Okay. So let's start from here. Okay. So we have post-surgical. In this case, the individual can't weight bear. So how do I gain size of the quad and the calf as fast as possible? There's not a direct correlation or relationship, but there's a correlation between size and strength. So I want to get that size back as much as I can. So if they're not weight bearing, like this gentleman wasn't, I'm going to have to do what's called our cellular swelling protocol. And that's using the cuffs. You can see the cuffs up here. The cuffs are at 80% limb occlusion pressure. I'm reducing the amount of blood flow into the limb. I'm going to cause cellular swelling, which is going to cause increases in size. I'm going to do it with E-stim and isometrics. The E-stim, we're going to set it to about a 3-to-1 work to rest ratio. He's going to match the isometrics with the E-stim. They're going to do 5 minutes on at 80% limb occlusion pressure, 3-minute rest. And they're going to do that for 5 cycles. Yes, 5 cycles. Protein synthesis has not been shown to be stimulated in 2 cycles. So it really requires these exceptional amounts of time. It takes about 46 minutes to get through this protocol. I am not in direct contact with the patient the whole time. I let them get the timer and I just let it run. I let the E-stim continue even during the rest period. That 3-minute rest, I let them just continue to let the stim. I don't change the stim, but I do have them continue to do only the isometrics during the 5-minute where the LOP is inflated. And then I go 3 minutes of rest, meaning I deflate, and we do that for 5 cycles. Let me see. I don't know if this will show up. Depends on your internet speed. You can see what he's doing here. And this guy, he had a lower limb fracture. We lost nothing on his quad. And we started literally 2 days after surgery. And he was immobilized for 8 weeks, 2 weeks prior to surgery, 6 weeks post-surgical. In the next case, I just had this person come in yesterday. This was a post-surgical distal femoral fracture. You can see her left leg is 2¼ inches smaller at the quad. Her calves were the same. You can see the tibial torsion that's occurring. So we're going to deal with that. This leg is showing up as a long leg, and why she's hyperpronating through this foot and externally rotating. She keeps this knee slightly bent as well. So I wish she would have had her shirt tucked in, but you would be seeing this hip angle dropping. But she's very self-conscious about the scar. She's very self-conscious about the quad size. So we want to get that quad up. Now, she can weight bear. It's been 2 years since her surgery. So what we're going to do is we're going to do isolated exercises with her. There's no reason to do passive cell swell. They might as well just get right into isolated exercises. And we're going to inflate the cuff, 80% limb occlusion pressure in the lower extremity. If this was an upper extremity issue, we would do 50% upper extremity limb occlusion pressure. She's going to do 30 reps. Then she's going to give a 30-second rest. Then 15 reps, 30-second rest, 15 reps, 30-second rest, 15 reps. Then we deflate the cuffs. I got 1 minute to get to the next exercise. For her, because this quad is so atrophied, I'm going to start off with, I haven't done it yet. We were just doing our consult yesterday. So I'm going to start off with, a long arc quad using probably the first day. I'll probably use like a 3-pound ankle weight off the edge of the table. She'll go through the protocol for isolated exercise. Then I'll probably do some sort of hamstring exercise. So standing in front of the table, doing a hamstring curl with a ankle weight attached to her ankle, pretty lightweight to start. And if she can tolerate, I might do a compound set of squats, but I'm going to try to fill that limb with as much fluid as possible within about 3 exercises in order for us to start to get some size. I think I'm going to have her normal size at about 8 weeks. We need to train at least twice a week. 2 to 3 times a week has been as effective as 5 times a week. She's also doing other things outside of working with me. So that should be enough to get that size back, which hopefully will equate to strength. Now, the other thing that I'm going to do with her in order to get this leg nice and tired is I'm going to have her walk. I'm going to do a walking protocol with her at probably start with 35% heart rate reserve, walk for 20 minutes on the treadmill. And that heart rate reserve with her should be right around 95 or 96 beats per minute. So pretty easy, pretty light, nothing too crazy, but it's going to get her legs really tired. And Abe has demonstrated that the walking protocol will improve size of the thigh. So I'm going to work her aerobic capacity as well, get some size of the thigh, and also do some isolated exercises. And then depending on how tired she is, go to an integrated exercise or compound exercise. So I'm seeing a lot of these old atrophies coming in, and it's a great application for BFR and she was very, very hopeful yesterday. I think I got her pretty excited because she's been 2 years now with this limb. The other thing that I've been seeing a lot of is stress fractures in the shin, like medial tibial stress syndrome. And I've also been seeing a lot of metatarsal fractures. So I'm going to talk about those next week and how we deal with bone. And so I'm going to break out of this and see if anybody has any questions regarding atrophy training. All right, any questions regarding atrophy training? Okay, great. If no questions, next week I'm going to be talking about bone healing. So happy to answer any questions in the meantime. You can DM me on Instagram. I am IG, I am Ed Laquera. Or you can send me an email, ed@edlaquera.com. All right, thanks so much. Have a great week.